Hi everyone. Thank you so much for joining us today for our webinar on how to optimize your billings and maximize revenue. I just wanted to start by introducing myself. So my name is Daniel Brenner, and I am the product manager here at DoctorCare. So just a bit about DoctorCare, just a quick introduction. We are the largest provider of billing and practice support to over 2,500 physicians across Canada. On average, we found that we've been able to help doctors recover $25,000 to $30,000 of additional revenue per year. So our solutions and services are designed to help doctors ensure they're maximizing their revenue, optimizing their practice, and of course, the most important part of it is actually improving patient care. I just want to take us through a bit of webinar logistics here. So just so you know, all attendees are in listen-only mode. So you won't be able to speak, so you're just talking to your screen if you try. We are recording this webinar, so it will be available to you after the event. If you have any questions during the webinar, please submit your questions. There's a Q&A feature at the bottom of your Zoom link. So please submit any questions there. They will be kept confidential and they'll only be seen by our team. At the end of the session, we will be doing a Q&A if the time permitting. One of my colleagues is on and will be answering the questions as they come into the webinar, as well as we'll go through any that we can at the end. And if we don't get to your question for whatever reason, we will follow up with an email. We don't want to leave you wondering. Okay, so some webinar goals. The purpose of today's webinar is to provide you with some best practices to optimize your billings and maximize revenue while still keeping patient care the focal point. We will guide you through best practices and methods that we have learned over the years so that you can apply them to your practice and manage your billings more efficiently and effectively. Ultimately, and this is a point I'll stress throughout the whole presentation, we want to help make sure you get paid for the care you are providing. So you're providing great care to your patients. You want to make sure you're getting paid for that amazing care you're giving to them. A quick overview of the agenda. So for today, we are first going to look at tips to keep you on track with billing. We know that over the past year, especially year and a half with COVID-19 and the pandemic, there's been a lot of changes to billing codes. There's a lot of updates from the ministry, and we want to share ways of staying on top of all of these updates. We'll be looking at managing and fixing errors and rejections. It's a very popular topic, these errors. They can get really tricky. How to fix the errors, why are you getting the errors, and even how to sometimes resubmit these errors can be an issue depending on your province. So we'll dive into that a little bit. We'll also be going over best practices for billing management and improving your workflows. We want to help set you up for success with your billing, especially when in-office appointments increase, as COVID's coming to, hopefully, fingers crossed, coming to an end. We want to make sure that as more patients are coming in office and you're doing both virtual care and in-person care, how to juggle that balance in your schedule. And lastly, we're going to be providing a few top billing tips and tricks that are specific to 4 provinces that we'll focus in on. Just little province specific there, but we're trying to keep it as broad as possible throughout the webinar today. So part 1, let's get started. We want to go through tips to keep on track with billing. So why is it important to keep on track with billing? First of all, the ministry is constantly, as I mentioned before, providing new updates and changes to billing. This means that if you don't keep on track of what you are billing and making sure that they align with the new updates from the ministry, it's easy to get confused and overwhelmed. Actually, recently, I'll give a quick anecdote from Ontario. We saw that the ministry introduced a new code for the COVID-19 vaccinations. And a lot of doctors were hearing this through word of mouth, but they weren't reading the bulletin. And the bulletin actually asked doctors to hold back on these bills for a couple months because the ministry had to update their systems to be able to accept these bills. And a lot of doctors were submitting these without listening, without holding them back. So what did this cause? It caused errored claims, so more time spent on these claims later on, and inefficiencies overall in the practice, right? So we're trying to reduce that. So by staying on top of these ministry bulletins, it really helps understand what you should be billing, how you should be billing, maybe where you should be changing some of those codes or holding back some of those codes. Also, by keeping on track with billing, you're less likely to have errors, right? Less likely to have errors from your billing claims because you are taking the time to accurately bill your claims and use the correct and most updated codes. Keeping on track with billing also ensures that you or your physicians, if you happen to be the billing coordinator, gets paid on time. And as I'm going to stress throughout the webinar, like I said, it makes sure you get paid for the care you are providing to your patients. It's a big emphasis for today. So the first tip I want to go over is making sure that you bill on a daily basis, right? So a big component of making sure you are getting paid for the care you are providing is making sure that you're actually submitting the bills. If you don't submit the bills, you definitely cannot get paid. We know that doctors and clinical managers are extremely busy, and it's very, very easy for claims to pile up. You think you'll get to it tomorrow or the next day, and all of a sudden, a week or 2 weeks have gone by. This is why we think it's extremely critical to get these done on a daily basis. It means you're less likely to forget the services you provided for that patient when you provided them and some of the specifics you might want in. So to apply this first tip to your practice, we have some methods of how we think you can do it. Of course, each practice is different. So we're just sharing what we think we've seen work with other doctors. So the first one is to record every encounter with a patient in the patient's chart during the visit. So after each appointment, make sure that you or your doctor, if you're a clinical manager, spend a couple of minutes to review the notes, make sure the details of the appointment are recorded accurately. So that's why we recommend putting it right into the EMR versus a day sheet, because often a day sheet, you'll scribble down a couple words, but you won't get the real meat of the visit on there. So you might say, a patient has a cough, but you forgot to mention that you discussed smoking cessation. So all of a sudden you missed an additional code that you potentially could have billed if you're a little more accurate with that. That's why we always recommend getting those details directly into your EMR so that you have the whole story. And even if you come back to bill it later, you can see clearly what you did with that patient. After your details have been captured, we recommend that you make sure you have some time booked off out of your workday just to focus on submitting your billings, right? So that way, what I mentioned before, where you mentioned you'll get to it tomorrow or the next day, you actually get to it right on time, right? So you get to it at the end of each day, or maybe you book it for the end of each week and you submit those bills, you have them in, you're billing on a regular basis. So we don't see any batch of bills and batch of payments, but rather regular payments. And it's much cleaner across the board doing it that way. Moving on to tip number 2, keep track of important dates. So the big thing here is we recommend that you add all cutoff dates to your calendar, any fiscal year cutoff dates, anything around that, you add it to your calendar or into your EMR. In this chart, we've outlined, what these cutoff dates are for each province, right? So in Ontario, you can see billing cutoff dates are the 18th of each month, and claims have to be submitted within 180 days or 6 months. Otherwise, they'll go stale dated. For Alberta, the cutoff dates are 4:30 p.m. on Thursdays, and all claims must be submitted within 90 days or 3 months. For Manitoba, claim submissions are bi-weekly, every 2 weeks, submitted at 5 p.m. on Monday to Friday and 10 p.m. on Sundays. And again, this is like Ontario, you have 6 months to backdate these bills. And for British Columbia, claims need to be submitted within 90 days of the original date of service. Otherwise, it will be refused. And again, there's a bi-weekly cutoff time here of 11 a.m., which is variable every 2 weeks of the day that it happens. So these cutoff dates are extremely important, as I mentioned before. If you don't get your bills in before the cutoff dates, you won't get paid in the following cycle, meaning you'll only get paid in the cycle after that. And that doesn't make for best billing practices. Moving on to tip number 3. So this one here is using quick reference guide, right? So 1-page guides, the most common codes that you can bill in your practice. And this can be super useful, right? So either you can have this as a PDF that lives on your computer, you can print it off and paste it on the side of your computer. I've seen that where doctors have it in each room, just so they remember they're not always billing the like generic codes that are easy to remember. But sometimes it's important to bill, your more specific codes that maybe get paid you, right? If you're doing a diabetic service, you should get paid for a diabetic service, not for a general service. It's important to accurately get paid for the claims for the services that you're providing. And the biggest barrier we often find of that is just knowledge, just being able to remember all of the codes because we know there's so many. So that's why we like having these cheat sheets around the office so people can take a quick glance, understand them, and build appropriate code. If you have a cheat sheet, great. If not, we actually have a whole resource guide on our website free of charge. You just have, if you go onto our website, you can see there's a resource library section there that has resources for each province. So please, by all means, if you don't have one, we highly recommend taking a look at the one we have, specialize it to whatever needs you need, but having some sort of reference guide with you at all times. Moving on to the fourth tip here with billing, right? We want to understand the premiums available. Premiums are something that most doctors are actually doing. They're just not always billing for them, right? So understanding the premiums available in your province and making sure to try and capture those premiums when applicable. So looking at, in Ontario, there's special visit premiums, as well as chronic disease premiums, right? So making sure you're billing, if you're seeing bipolar schizophrenic patients, make sure you're billing for that. Otherwise, you won't capture those bonuses. In Alberta, we see after hours premiums, we see rural remote program, which actually falls into 2 rural incentives. And we see complex modifiers, which is a big premium that you can get out in Alberta. In Manitoba, we're seeing that there are CDM incentives there, so that's properly billing your patients, making sure that you are finding the right patients to bill these incentives for afterwards is sometimes a struggle. And same concept in British Columbia, right? These chronic care management patients, so finding your heart failure patient that you have done management for and billing your incentive code for them. We do understand it is hard to keep track of that. It's hard to know, have I been seeing them for the last 2 years? Have I done enough visits? We do offer services that help out with that. So please ask if you have any questions. We can go through what our process is, how we go ahead and track that. Or if you have good process in place, just making sure staying on top of that is extremely important because again, this is getting paid for the services you are providing for patients. And moving on to tip 5, this kind of relates back to what I started off with, right? Being on top of updates from the Ministry of Health. What we've seen a lot, especially through COVID, is updates are coming all the time, whether it's new codes being introduced, how you can bill codes being applied differently. So it's really important to stay on top of all of these changes, right? Because not only does that offer you new codes to build, but reduces your errors as well, and errors are very timely and costly. So we kind of have a couple recommendations that we think you can do here, right? And what I personally do actually is I bookmark all of the Ministry of Health websites, and then on a daily basis, usually when I'm having like my morning coffee, I quickly take a look and see. Quickly take a look and see if there's any if there's any updates or new things I should be focusing on there. With that being said, I also know it takes time to go and do that every day. So we also offer a newsletter. Right now, the newsletter is for Ontario and BC, where you'll have one shortly in Alberta and Manitoba. But this will offer any new updates that we have for each of the provinces. So if there's any big ministry announcements, we'll release a newsletter. So if you're interested in signing up for that newsletter, it's of course, again, free of charge, and we're just happy to be able to share that information with doctors. Okay, so moving on to part 2 now, and this has been a very big topic we've had during COVID, right? This is managing and fixing your errors and rejections. We have seen an influx of errors during COVID. So historically, actually what we found is that errors and rejections represent on average about $5,000 in lost revenue on a yearly basis. This is actually probably a lowball from what we've seen in the last year over COVID. We've seen an increase in errors. And actually just a quick story of, something that we saw, because a lot of doctors always tell us like, hey, I'm amazing at my errors. I'm totally on top of them. A lot of them are. But we actually had one doctor who came to us and, we approached them and we said, hey, like, how are the errors going? And they said, they think they're on top of it. Maybe a few hundred or 1,000 get thrown in a year. And so we offered to run a complimentary audit for that doctor, right? And we found they actually had over $30,000 worth of errors outstanding that could still be corrected, which is crazy, right? It's a huge number. So we went ahead and fixed that for them. What was upsetting to see is how many errors actually were left on the table because they're already stale dated. So it is really important that you're aware that errors are a big thing. They're timely and costly, and we understand that, but staying on top of them and correcting them is really, really important. We do have a huge specialty in this, so if you have any questions about it, please don't hesitate to reach out. We're happy to share some of that knowledge that we do have. What I will be doing though is going through some of these most common error types, right? So we've found about 5 categories that we find are the most common types of errors. And really, there are five categories, but what we've noticed is the biggest one, especially during COVID, is the patient demographic information, right? Specifically like updated health cards and all of that. As we've gone virtual during COVID-19, we've realized a lot of processes of checking health cards has kind of fallen out of whack. So that leads to a lot of rejections, a lot more time spent on these claims. So this is a big one that we'll focus on today, of how to reduce those errors. We also, another common one is no referring physician, right? So you get a referral, but you don't put the referring physician number in, or it's not a proper physician number. And so now that claim's coming back rejected. And then we see in lesser amounts, but also, invalid use of premiums, fee code conflicts, or 2 codes that can't be billed together, or, a patient who just doesn't have insurance, which actually has probably happened a bit more again during COVID. So to jump into these error types and how to manage them, right? The first one I wanted to talk, and really the biggest one I think to talk about, is patient demographic information. So the question is not to me, how do we fix these errors? I'll talk briefly on how to do that, but really it's how to reduce the amount of errors we see for patient demographic, right? So for us, what we've noticed is during COVID, patients used to call, book an appointment, come in, you check their health card when they come in before they see the doctor. And that's great, right? So you've checked it, you've updated, maybe a few fall through the cracks, but for the most part, you should be capturing them. What we've noticed in COVID is that isn't happening, right? So what we've been pitching to doctors, take that one step earlier, that anytime a patient calls to book an appointment or to see the doctor or to have a bill, right? If you ever want to bill them, you want to start at that point getting the updated patient demographic information, right? So you get the right demographic information, you update it in your system so that by the time they see the doctor, and the doctor who might forget to update to ask or check, that's already been fixed. So you want that first point of contact, the front office staff who can answer the phone, update the system to be correcting that. That's our big pitch right now, because we know systems are broken. So that's hopefully helping to break those, to fix those broken systems. Of course, to fix these errors, the common way of fixing is calling the patient. Some provinces have ministry hotlines. We actually do call ministry hotlines on behalf of doctors to help get those new version codes, so we can always help out with that process. But really, that's timely and costly. Rather spend a few seconds on each phone call and making sure you're the right patient demographic information right from the start is the goal. And then going into the no referring physician common error, right? So this does happen quite a bit. A doctor gets a referral, the referring physician puts the wrong referral number in, they forget to put the referral number in, there's a whole whack of things that can happen there. So first and foremost, right, we do want to try and get the referring physician number to try and update it before submitting that bill. You don't want to just submit a bill if you don't have the referring physician number, it'll be rejected if the bill requires it. So the first and foremost, try and get that referring physician number, double check it with them if it's been rejected, get the new one and keep it on file. And then also, if there's no way of you getting that referring physician number, we also, there's always codes you can bill that do not require a referring physician number. So we do recommend going for those as a second step. The best step is always build the most accurate bill, the most proper bill, but sometimes you have to go for that second step. So moving on to the two, we see these errors, they're not across the board as common as the previous two. But they kind of lump together, right? Invalid use of premiums and fee code conflicts, right? It's billing codes, you're not supposed to bill them or at the wrong times. And really the biggest thing, and this is province specific, and we have cheat sheets for each of the provinces, but learn about how to bill the premiums in each province, when to bill it, like do you have to bill on a certain day in the fiscal year? Can you only bill on certain patients? Does it have to be a blank patient? Depending on what it is, you have to really learn about that. And what we actually learned recently, we did a quick dive into fee code conflicts, right? So codes that can be billed together or not. And we found that, there's tens of thousands of claims that can be billed together in different combinations. So we understand that's very confusing. It is best to stay up to date with your scheduled benefits from your ministry and making sure that you understand what codes can or cannot be billed together. For us, the easiest thing to do, again, is quick reference guides. Using these quick reference guides, we explain, hey, these two codes can be billed together, this code can or cannot. Also, a very easy thought is like 2 assessment codes generally can't be billed together, right? Or 2 consult codes generally can't be billed together. An assessment and consult on the same visit. Again, the ministry doesn't always like that being billed together. So it's thinking about that as well. It's like, hey, 1 assessment or 1 consult code is usually the general rule of thumb. There are exceptions to that as always, but that's like an easy way of thinking around it. And the last thing I want to go into here is just patients that don't have insurance, right? So there's a couple ways you can go about this. One, again, when a patient calls in to book the appointment, that's when you should be finding this out. You shouldn't be finding it out after they've already seen the doctor. You should be always pushing your patients to update their insurance if they're eligible. And if you have to bill out of pocket, I think that's a last resort and not something we want to do. But if they're uninsured, they're uninsured. So yeah, the big thought here, I think the big overall theme, right, is make sure you're checking your bills, double checking your bills, double checking patient demographics, all that stuff. It might spend a little more time today, but tomorrow I think it'll save a lot more time for you and ensures that you are getting paid for the services you're providing to your patients. So one thing that we are getting asked a bit lately is, how to actually fix these rejections in your EMR. And of course, this is specific to each province, right? So I can't give an overarching, but in British Columbia and Ontario, it's a simple go into the EMR, edit the claim, fix the claim, resubmit the claim. So it's a little more simple. In Alberta, in the EMR, you have to change your action codes, right? So if it's a refused claim, that should be fixed and resubmitted. You have to put your action code as A. To have any applied claims changed or reassessed, right? So if those are already paid at full, partial, or zero, you may have to resubmit the changes with action codes C and R respectively. And then if you've already had like a paid claim in Alberta and you want to delete the claim, you want to make the action claim as D and then submit a brand new claim. So you can see it's a little bit more confusing in Alberta. Ontario and BC, it's right in the EMR. So it just depends on the province. We have had experience correcting claims in each province. So if you have any questions, again, please reach out and don't hesitate to ask any questions. So just moving on to part 3 now, we are going to be looking at improving your billing management and workflows. So the goal here, right, is we want to make sure that you are optimize your revenue. We got to start at the beginning of the process, right? So with the patient and scheduling their appointment. So we did touch upon this point in fixing errors. But when booking an appointment for the patient, your staff who's answering the phones and booking the appointment have to be sure to capture demographic and insurance information. It's even a good practice to get an idea of what the visit's going to be for, right? So it gives you an idea of how long the visit might be for. Do you want to book it for 20 minutes instead of 15? Is it a WSIB claim? Do you want to prepare a form? So getting that little snippet of information can help a lot down the road and optimize that visit when the patient actually comes in. And then even go one step further, right? Again, once the patient's coming into your office, when we get back to that normal, you got to check that patient's health card again. You got to make sure that it's all valid and all up to date, so that there's less errors that's coming down the road. We know there are some exceptions right now in some provinces where expired health cards are being accepted. We wouldn't say to rely on that. We've spoken to the governments and they say if there is an updated health card, you have to get it. And they've been pushing for patients to still get updated health cards, even if they're expired. So we recommend still doing this double check every single time. It's a best practice to get in the habit into. Another thing you're going to want to try to do with your scheduled appointments is reduce your no-shows, right? So there's a few ways of reducing no-shows. One is if it's an appointment you're booking on the phone, you want to make sure, even if it's a non-urgent appointment, try and book it within the week. If you start booking a month or 2 months out, patients will often forget about that appointment. In the same week, there's a much greater chance of them remembering it. And not only that, but if you're booking someone for a week out, right, ask them, hey, can I put you on the waiting list? So if there's a no-show, they can show up. So that reduces that empty time slots, right? Because if there's a no-show, you can call the patient and they can be there within a few minutes, the goal, so that you don't miss that appointment time slot. With that in mind as well, we also want to make sure we leave sufficient time in our day. So about 1 to 2 time slots in your day. Some doctors even leave up to 3 within the same day for urgent situations, right? So to make sure if there's any emergencies that come up, you need to make sure there's room for those patients. Otherwise, they might have to go to another doctor, probably won't get the same level of care because if you're the primary care provider. And that's why you want to be able to leave that room for them. And then we also really, really recommend, we love technology. We think it really can help. So, like I mentioned before, if you have to have an appointment for 3 months out because you're booking a follow-up diabetic visit, you probably want an automated reminder for the patient. Use your technology, right? So you can send them a text a week before, a day before, just to remind them they have that appointment. And that will also help reduce your no-shows that are coming up. So speaking of technology, we really, really say it's great to be able to take advantage of your tech. So if you're currently using a practice management software of some sort, we'd say you're probably one step ahead of the game. If you aren't, it's not the end of the world, but I would recommend considering looking into some of the practice care management softwares out there. Healthcare technology has really been evolving every year. We see really, really big steps forward. And there are many features and options that you can implement into your own processes to provide services efficiently and effectively to your patients. For example, some of these practice management software systems, they have reports with real-time results of patients you see each month. So cool information you probably never see. Your payments you receive that month. Patients who might be overdue for visits, so like chronic care patients who haven't been in for a long time. Recall lists, missed billing opportunities. These softwares have become very sophisticated and can help drive a lot of your daily decisions and even some of your revenue. So the information is extremely valuable for you to keep on track of your patient's health, so best health for your patients, and enable a more proactive approach for your patients. And it can even ensure, help you get tests up to date, follow-ups are up to date, all of that important stuff. And then as well, in addition, many systems allow patients to directly book, cancel, or reschedule their appointments. So they can do that online without even talking to someone at your office. So we're talking about really taking the burden off of your staff so that they can focus on their practice management tasks, right? Rather than answering routine phone calls, it can actually be done automated. And allowing patients to even use an online portal that you may be, wanting to use it. You can put important information up there about COVID-19, vaccines, whatever it is. It reduces the amount of incoming phone calls and therefore reduces the burden off your staff, which makes a big difference to performing day-to-day tasks. We know that people have a lot on their plate as it is. The third point we want to jump into here is training your staff, right? Like any company, any organization, any person, the better trained you are, the better you'll be for the job. So we really, really do value training staff on best practices for billing, ministry reporting, workflow optimization, EMR capability, and error reconciliation. Those are just a few that we highlight. If there's any other routine tasks you do in your office and you feel like training should be done for it, the better someone is prepared for the job, the better they'll be able to perform it. And that'll save time in the long run. It might take a bit more time on day 1, but on day 100, it'll save you a lot of time. Actually, at DoctorCare, we do have a primary care staff training program where we help train staff. And what we've learned from this after doing these tasks with staff is we've seen huge efficiencies in the clinic after, right? Staff understand when to book patients, should be in the morning, afternoon, when to leave appointments available, when to submit certain bills, how to correct certain errors. It takes a lot of the burden off of physicians, as well as it allows staff to be enabled to quickly do these tasks rather than having to fumble through some of them. If you are interested in that training program, please reach out. But also, if you're very comfortable with it, or you have senior people in the clinic that you're comfortable in training everyone else, that also works very well. So I'm going to move into our last part here, part 4, which is top billing tips and tricks. And we're actually going to dive a bit into each province. I know we have people here across Canada. I wanted to dive into just 4 provinces. So we're going to go through Ontario, Alberta, Manitoba, and BC, and just go through a few top tricks in each province. It won't take too long because I don't want to, if it's not your province, I don't want you to hop off. But I'll start off in Ontario, right? What we've seen in Ontario, and again, I'm going to beat this point again and again, is that you have to double check your version codes. We've seen so many issues with version codes, especially during the pandemic, that it's really, really burdensome on the office staff to have to correct those after the fact, right? Like I said, spend a few more minutes today to save time tomorrow is the big goal there. The second tip here is to make sure you are aware of the annual bonuses and deadlines, right? So physicians should be aware of the annual bonuses and incentives available to them. So if you're a family doctor, depends on your patient enrollment model. But there can be up to $20,000, $30,000 of additional revenue you can make from those bonuses. If you're not familiar with that, please reach out. We'd be happy to get into the details. Knowing your patient enrollment model, if you're a family physician, right, it changes the way you might want to bill. It changes how you get compensated. Are you getting from capitation from your roster, or are you getting from fee for service from your billing? It really depends, and you should know how you're billing and how you're getting paid. We find a lot of doctors don't want to look at their pay stubs from the ministry. Understandably, they're not the prettiest thing, but it is very good to understand how you're getting paid, because that could help focus your practice a bit. And lastly, for Ontario, it's just roster management, right? So it's understanding who is rostered to you. You get paid for the patients that are rostered to you if you're in a patient enrollment model. That payment, if you're in a FO or a FIN, can be 70 to 80% of your income. If you're in CCM or FIG, 20 to 30%, it's a big chunk of your income. So making sure that your rosters are up to date. If you need to run a roster reconciliation, making sure your patients are rostered, we'd be happy to help you with that as well. But just staying on top of that roster management. So those are a few quick tips from Ontario. I'm going to go over to Alberta now, right? So the first one here is to check for applicable modifiers, right? So most, but not all of the 03.03 and 03.07 codes are compatible with CMGP modifiers. Physicians should always double check to make sure they're maximizing this billing potential. We've actually run audit reports to double check if we think that physicians might have missed it. And there's often quite a bit of money left on the table here, right? Same thing with the CMXC 30 modifiers, right? With the 03.04 and 03.08 codes. There's often a lot of potential revenue of work you've done, care you've provided, with money being left on the table there. The next tip for us is to be really mindful of that visit cap, right? So for physicians there's a 50 patient visit cap. So 0 to 50 patients, you get paid the full amount. 50 to 65, you only get paid 50% for each visit. And 65 and over, you actually don't get paid anything for that visit. So it's very important to be mindful of that visit cap, right? If one day you're working 12 hours and you're seeing 100 patients, but you're not really getting paid fully for 50 of them, and the next day you're working 2 hours and seeing 15 patients, right? Even out your schedule, make sure that that's dispersed evenly, because you don't want one day to be crazy high and the next day to be next to nothing. And all of a sudden you've lost out on a lot of revenue for providing the same care, right? So just billing a little smarter, organizing your schedule a bit better. And the third tip here is, again, as I'm gonna really, really push, is making sure your coverage and demographic is up to date when you're booking for the patient, right? So I mentioned this a few times, but it's so important. Patient coverage should be checked prior to each visit to ensure that uninsured patients are, if you have to bill them out of pocket, or if a patient has updated demographics, you're doing that as well. You want to make sure you're getting paid for those visits. Jumping over to Manitoba. So the top billing here is to make sure that you are enrolling your patients properly, right? This has repercussions for like your comprehensive care management, right? So you have to bill patients for the CCM, and you can only bill them if they are enrolled. You can only bill those incentive codes if they're enrolled. So you have to make sure you know who these enrolled patients are, and you're billing for their CCM bonus. So that leads me to my next point of billing for that comprehensive care management, right? You have certain bonuses you can bill for based off age or risk factors, and you want to make sure you are billing for those patients. If you've never looked into this, we do run audits for this as well. So if you want to see if maybe you've missed out on some CCM potentials, we can take a look at that for you. And on that same thought process, CCM is recalling these high-risk patients, right? For best patient care as well as better billing purposes, you want to make sure you're recalling these high-risk patients, because you get paid for them well, it's best patient care, most importantly, and it activates these CCM incentives. So again, we can create recall lists for physicians that we work with as well. So please don't hesitate to reach out if you have any questions about that. And the last province that I'm going to go through is BC, right? So BC, there's three things we want to focus in on here, right? First of all is that panel development, right? So the BC government gives a incentive for panel development. They'll pay you up to $3,000 to make sure that you have proactively managed your patients through your EMR, right? So using data in your EMR so that you can respond to patients' chronic preventive care needs. So again, we're talking about better patient care, and the ministry is willing to pay you for it because they understand it takes a lot of time. And then on that same theme of proactively recalling patients, it's always best to recall these chronic care patients on a regular basis to get best care for patients, and it pays well. So we're thinking diabetics, hypertension, COPD, and heart failure are the four the ministries highlighted for those incentive codes. And again, not only is that best practice, but it also gets paid well. And then one step further, right, those four categories, if you're following the patient for a couple of years, you're eligible to bill certain incentive codes. And those incentive codes can go a long way. We run audits for doctors all the time where there's thousands and thousands of dollars that could potentially be sent on the table just because it's hard to track who to bill, when to bill it, how to bill it. So we help doctors stay on top of that. And we can even help with billing those codes for you as well. So those are some key things within each province. I just want to go through some key takeaways before we get to a little Q&A session at the end. And I know we're close on time. So some key takeaway from today's webinar, right? So first and foremost for me is take time to get organized and stay up to date with your billings, right? Take a few extra minutes today, as I've said a few times, to save time tomorrow. So even if you're taking 30 minutes to submit your bills during the day, or 10 minutes in the morning to check updates from the ministry websites, it saves you a bunch of time and it helps maximize your revenue down the road. Make sure to be on top of your premiums in each province. There are huge potential earnings through premiums, as well as staying with best patient care. So stay on top of those premiums, recalling the right patients, and being able to bill those is extremely important. Big takeaway, double check your work, right? You want to make sure that you're reducing your errors, so you're getting paid, and you're reducing the amount of time spent to fixing those things. So double check all your works, reduce the amount of rejections, save you a bunch of time, you and the staff around you. Another big takeaway for us is to proactively set systems in place in your workflow to make sure that you are reducing errors and rejections. We're gonna hone in on that because we find errors and rejections are a key issue. So this includes improving your appointment scheduling, or even just taking advantage of practice management software. And lastly, I do want to say, like, we are here to help. We're more than happy to help. If you have any questions, anything you're not sure of, you want to run an idea of how you think your clinic might work best, we're happy to discuss that. We love learning new ways that clinics do it and seeing these new ideas. So please don't hesitate to reach out. And we do have a promotion actually going on right now. So I just want to let everyone know, we do help with billing, right? Fixing errors right in your EMR, and we're offering up to 6 months for free with no obligation. And as I mentioned earlier, right, doctors that we spoke to who thought they were decent billers with no rejections could have had $20,000, $30,000 worth of rejections just sitting there that were totally actionable. So please, if you're unsure, you just want an audit, we're happy to run that for you and bring you more clarity. Okay, so that's me talking a lot. I hope everyone's okay with my voice. I do want to move into the next section of the webinar, which is our Q&A section. Sorry. So I'll see if any questions have come through, and as well, my colleague I know has been answering some question. And if we don't get to anything, and there's anything that you still have questions for, I'll leave my email address here, and you can definitely reach out to me after. So the first question I see coming through here, right, is if I forgot a modifier. This is from an Alberta doctor. You can see the question is if they can get paid for these visits still, right? So as I mentioned earlier, we do run reports for doctors in Alberta, and we find that there's a lot of modifiers that are left on the table that they could have built. You are eligible within the 3-month time window of Alberta, lets you backdate your claims to go back and add that modifier in. So you can add the modifier, you just have to put the action code as C and resubmit that claim, and it should get paid to you. And then I've got another one from Alberta lined up here. I need help with reversing a bill when a doctor accidentally bills for a phone call, right? So the doctor, what it sounds like, billed for a phone call, which is a lower amount for a phone call. The patient then came in office after, and they want to actually bill for that office visit because you can't bill for both visits right now, unfortunately, if they happen on both on the same day. So yes, you can, even if you submitted the one and you want to submit the other, you can do that. What you have to do is you first have to basically delete that original bill. So what you do is you come to that paid claim, you mark the action code as D, right? So that deletes that bill, it removes it, and you just resubmit a new code. You resubmit the new code that you want to have paid. The next question coming here from Manitoba doctor, if the patient has to be enrolled for the whole year to be billing the CCM bonus. And that's a great question because we were reading through the schedule in Manitoba. It wasn't very clear. So we did speak to the ministry there. And what we learned was that you don't actually have to have the patient enrolled during the year while you're seeing them for those chronic care management fees visits. What you do need though is you have to have them enrolled when you're billing for the bonus. So as long as you enroll them before you bill for the bonus, they don't have to be enrolled for the whole year, just before that bill date for that bonus. And one last question I'll quickly go through. It's a pretty big question, so if you want to follow up, please, I'll give you my email after, but it's how to bill the COVID-19 assessment center codes in Ontario. So this is a big question. We've had a lot of it. We've actually put out a couple of blog posts about how to properly submit it. But essentially there's two COVID assessment center codes, right? There's an H49 and H410 are the two codes, whether it's the daytime or the nighttime. And to bill these codes, you bill them in units. A unit is an hour. So if you do 5 hours in the daytime, you bill 5 units of H409. The way you bill it is you have to basically like create a new doctor in your EMR. So you're going to want to create a new doctor. It has the same billing number, but the group billing number, you're going to have to change the COVID assessment center. So those start with M, and then there's usually 3 more numbers afterwards. You're going to have to change that to that. You're going to have to bill through that doctor on a blank patient. So blank patient means no health card number, no version code, no date of birth. And then you submit that claim through that way. So it's a little complex. If you do have more questions about that, please don't hesitate to reach out after. I'm going to share my email right now because it is 3:15, which is 45 minutes in. I don't want to spend too much longer. I see there is a few more questions in our Q&A. So us and the team will go through it and still answer them. But we just don't want to take up everyone's time right now. So this is the end of the webinar. And again, thank you everyone so much for coming on behalf of DoctorCare. We really, really appreciate that you joined us today. If you have any questions or any feedback, my email is right here. It's brenner@doctorcare.ca. You can see it right here. And please feel free to reach out to me anytime. I love feedback. I love any questions that we can look into. Otherwise, have an amazing, amazing day. And yeah, hopefully we'll hear from you soon.